I've always been interested in eyes, and I guess that really kicked off when I was at high school and was at Guildford Grammar doing an eye experiment with an ox eye, and that was where I sort of was intrigued with the anatomy of the eye. The medical school at UWA was a fantastic experience for me. There were plenty of opportunities to go to Kalgoorlie or go to Kununurra as part of the medical school, and during these times they were really formative in my passion and interests evolving for outreach work. And I was always trying to think, how would eye surgery and ophthalmology fit in that context? Each country hospital had good cataract surgery facilities, but the equipment used for many common conditions were falling behind the standard of care. So this vision van brings all that equipment to 16 different hospitals around Western Australia. Each week we pull into a town and we'll see about 40 to 50 patients a day.
Oh yeah. Good mate.
And that requires a lot of assessment on the van and management. You're looking into someone's eye and having a chat. We certainly have really good relationships with the patients and they are appreciative.
Thank you, Doctor.
Okay, no particular questions?
No particular questions.
We'll chat later.
See you soon.
Bye-bye.
Thank you.
Treating eye conditions really is a cost-effective healthcare option in terms of the quality of life that people can achieve and the other economic benefits. But when you're working in the country, you're not really thinking about that. In actual fact, it's just one-on-one with a patient. It's a rewarding career because it's quite personal. From the smiles on the faces and the people that are receiving this care for free, it's a major bonus for their community. Most eye conditions can actually be prevented if they are screened for early. And so having this facility connected to the optometrists who are out in the remote areas can help screen for conditions before people become blind or lose vision. For Indigenous people, there are 6 times the rates of blindness compared to mainstream populations. And in addition, for diabetes, it's been 14 times higher rates of vision loss. I'm going to actually do some treatment on the eye with a lens. You'll feel me touching, but it won't cause any pain. The good news is that in the last few years, more surveys have been done, and these rates are being halved with all the work around Australia that's going on to providing access to eye care. There's a long and exciting pathway ahead if you have an open mind and are curious about the world. Fortunately at UWA we're given opportunities to think beyond the box and invent new ways of doing things and consider how to be curious in the world around us and do something useful for society.